Good afternoon, and thank you for joining me for today's town hall. I'm Janice Scott, and as always, extremely proud to be your president and CEO. We're in the midst of an unparalleled crisis against an enemy that continues to morph and challenge us on every level. For 2 years, Team RVH has worked tirelessly under extremely difficult circumstances, continually updating protocols and responding to ever-changing circumstances to ensure the safety of our patients and each other. But we may finally be seeing a sliver of light at the end of what has been a very, very dark tunnel. Experts suggest this wave of the pandemic will peak in January, and while hospitalizations and ICU admissions will continue to rise into February, we are seeing a slowing of that growth. As Omicron spreads like wildfire across our region, many members of Team RVH, along with their families, became sick or exposed, resulting in an unprecedented staffing shortage. We're cautiously optimistic our staffing situation is improving slightly as more employees and physicians start to come back to work after isolating. But make no mistake, we aren't out of the woods yet. Yes, there are some hopeful signs, but hospitals throughout the province remain under tremendous pressure, and it's too early to know the impact of children going back to school this week. We do know hospitalizations lag several weeks behind new cases, so February will be a difficult month as well. But I have every confidence that Team RVH will continue to support one another and see our patients through whatever lies ahead. So we have much to share, so let's get started. Today I'm joined by Dr. Jeff Tyberg, Chief of Staff and Vice President, Academic and Medical Affairs, Tracy Fletcher, Operations Director, Medicine Program, Innisfil Health and Wellness, the Regional Pandemic Response Unit, and the Central East Stroke Network, Co-Chair, Barrie and Area Ontario Health Team, and Interim Director, Critical Care and Discharge Planning. So Tracy, I think you now have the longest title in the organization, just surpassing Executive Vice President Nancy Savage, and thank you for all that you do. Kathy Clark, Director of Safety, Security and Occupational Health, Shara Lamoureux, Registered Nurse in RVH's Emergency Department, and of course, ONA Local 134 Coordinator and RVH Nursing Sector Bargaining Unit President. And Veronica McLymont, who's the Registered Nurse in the Respiratory Unit. Welcome, Veronica. So let's begin with Dr. Tyberg. So Jeff, 2 weeks ago, we were looking at a pretty dire state of affairs. So what's the situation now at RVH and how are we coping?
Thanks very much, Janice. I'm pleased to be here with everybody. So I described the situation, I think, and everybody knows this remains a very serious situation, but perhaps we've seen a little bit of stability over the last number of days and maybe some signs of hope, also certainly still concerning. So we still have, a significant number of COVID patients in the organization, a total of about 81. About 40 of those patients are active. 36 are on the wards, 4 in the intensive care unit, and we're admitting some every day. But the total number is staying relatively stable. It's even dropped a little bit today, so I think that's somewhat of a hopeful sign. Of course, one of the major challenges have been the shortage of health human resources, both here and all across the province and around the world. Hundreds of staff and credentialed staff has either tested positive or had high-risk exposures and had to be off of work for that. So this has required redeployment of staff to be able to work to lots of other units. And I think the flexibility of people moving to other units has really been appreciated, as has the work of HR and others in terms of helping people move around. So I think that's helped. I think we're starting to see a little bit of a drop in terms of the number of people going off ill, and that's good. It's also kind of a good time to acknowledge the amazing work that's been done by HR, by IPAC, by Occupational Health and Wellness, sort of managed through this sort of really challenging situation. Who they've had to take a lot of recommendations that have been kind of a constantly moving target and adapt to them. So I think that's really positive. We're down to about 3.8% of our total staff that are off, and that's down about 1%. But, of course, we've also had to limit the regular care that we provide to patients, programs like surgery, some of the clinics, for example. That's a frustration, certainly for the patients, and it's a frustration for our staff as well. That's based on directives from the province. The backlog grows, and, that's something concerning that we'll have to deal with in the future. Lots of other units, I won't mention them all, have had to work through some really challenging circumstances. Of course, the units taking care of the COVID patients. The emergency department's another good example. They've had to handle regular patients that can't access primary care. It's really been a challenge, all while dealing with PPE, and we're really grateful to them. I think overall the team's surely tired and frustrated with the sort of seemingly endless waves that we're seeing in this pandemic. But we have a great team, and I think everyone's really looking forward to trying to get back to normal so that we can continue to provide the great care that we always do here at RVH.
Thanks, Jeff. Hospitalizations have hit a pandemic high, and certainly the Omicron variant is different than the others. But, are we expecting those numbers, the hospitalization numbers, to translate into worrisome levels of critical care admissions?
So, I think provincially we have started to see ICU numbers that we haven't seen before. We're up over about 600 today, and that's even though the variant itself causes less lethality and less admissions to ICU than previous variants, because so many people have it at the same time. We end up with a significant number of patients in ICU, and there's no question that some ICUs in Niagara region and Hamilton regions, even in the GTA, have been really, really challenging. There have been a lot of transfers around the province. The ICU admissions are a bit of a lagging indicator. They come a little bit later than the admissions do. So some places are very stressed. More than others. We've seen a significant number of transfers, including some to here and including some to protect tertiary and quaternary programs as well. But I think we're ready if we need to be. We've got some patients in ICU now. If we need to expand our ICU, we've got a plan, we've got the staff, we've got the team to do it. So hopefully we won't see large numbers, but if we do see them, we'll be ready.
Thanks, Jeff. And you've talked about this wave really being a health human resources crisis, and yet many hospitals in the GTA and the Hamilton area have been even more overwhelmed. Hundreds of staff off work, no capacity in their ICUs, multiple units and outbreaks, and many COVID patients being admitted each day. So last spring, RVH supported those overburdened hospitals by accepting the transfer of more than 220 GTA patients. So Jeff, can we expect to see more patient transfers, and do you think we're ready for that?
So Nancy Savage and I continued to sit on the GTIMS, which has been really effective in sort of trying to balance the wave. So this wave it's somewhat more symmetrical. It's striking everyone a bit more, but it's still not perfectly symmetrical. And as you said, some places are much more hit than others. We've already seen some ward and ICU transfers to RVH, and we've also moved some ALC patients out of RVH and out of the region. So I think the need for more ward transfers is hopefully diminishing. Some of the hospitals that were previously asking for rescue aren't asking for rescue anymore, but I think that possibility certainly remains. We're not sure what's going to happen. I think if we see transfer, they may more likely be into the ICU, where we may have some capacity. But again, I think we're ready as an organization, as a team. If we need to take more ward transfers, we will. I think the contribution we made in previous waves is very respected in the GTA. And I think if we say we're ready, we'll get some, and they need to send some patients, we'll get some. If we say we're overwhelmed ourselves, then because of all the contributions and the credibility that we have, I think we won't get any patients that we're not ready to take. So we may see some, hopefully not as many as we've seen in previous waves.
Thanks, Jeff. So I think in many ways, this wave has been the most challenging of the pandemic. So as our chief of staff, how are our credentialed staff doing?
So thanks for asking, Janice. So I think like everybody else in the organization, they're tired and frustrated dealing with a sort of apparently never-ending pandemic that we're now into wave 5. And frankly, Care 4 was a challenge in that little bit of a lull, and they've gotten through that. And a significant number of credentialed staff as well have been off work because of testing positive or high-risk exposures. And like all our other staff, that's been difficult for them and their families. And furthermore, one thing that's surely upsetting them is their inability to provide care that they want to their patients. For those that are limited, people in the surgical program, for example, they have patients that need joint replacements or other care. They're doing urgent and emergent care, but that's what they do, is they want to provide care. So they're surely frustrated by that. But I think like all the other members of Team RVH, they're working really hard under the circumstances to provide the best care that the organization can, with virtual clinics, doing emergent and urgent surgery. The ED and all the units are working. And I also think they're really appreciative of all the others on the team that have been working so hard to keep us functioning as well as we have. The people in HR, IPAC, occupational health and wellness, procurement, EVS, everybody that's just really working hard as the team that we are, so that we are able to provide, still a significant, not the normal amount of care, but a lot of care. So like everybody else, I think they're hoping that there's some light at the end of the tunnel and they can go back to what they do so well with the rest of the team, providing really outstanding patient care.
Thanks, Jeff. And thank you for your steady and thoughtful patient-centered leadership. Your years of working on the front lines in the emergency departments in Toronto, your network, and your relations across the province have been so beneficial for RVH. And also thank you for finding the time for our Caring for You committee. You're an important member as well.
Thank you.
So if the pandemic has taught us anything, it is the need to be flexible and nimble. Over the past 22 months, we've modified spaces, introduced new ways to care for patients, managed multiple outbreaks, and pivoted to ensure that we can safely provide care for those with the greatest need. So Tracy, welcome. And how are we ensuring that we have enough beds?
Thanks for having me, Janice. Well, we've opened a number of spaces throughout the health center as well as outside of the health center. So we've opened the IOF, which has been open for a period of time, as well as the Regional Pandemic Response Unit. In addition, we've opened multiple beds on ISU, Integrated Stroke and Rehabilitation, and the Specialized Seniors Program. In addition, with this wave, we've opened the 3 South B, otherwise known as RESP 2, as a COVID unit. Unfortunately, they're all full as well. We've now started to borrow some beds from our friends in surgery, and we continue to provide high quality care in every area of the building. On top of that, the mental health program as well has made a special area in their child and youth mental health area to ensure that their patients' care needs are met as well. In addition, in case the ICU wave does come, we have just finished creating 7 temporary ICU beds in fast track endo, and they're ready to go if we need them. Thankfully, today we don't. Every day we meet as a group at 8:30 as an ops group with many senior leaders to discuss the current pressures within the building and what we can and what we cannot do. As well as there's a bed meeting every day, and we work together collaboratively between programs to ensure that every patient gets great care. And I would say that's one of the great things about working here.
Thanks, Tracy. I mean, that theme that you and Jeff both raised of working together, caring, it's those values, I think, that are carrying us through all of this. So Tracy, you lead our COVID units, the field hospital, and our ICU. So I mean, since the beginning of this pandemic, you have been in the eye of the storm. So from your perspective, how are you and your teams doing?
From my perspective, it's been really tough. I think we thought the first wave, it would come, it was difficult, we had to change a lot of things, but it would end. This pandemic has dragged on and on. It's taken time from families and friends. But when I come to work, my teams are challenged every day to get new protocols, new procedures. Once we've got something solidified, it tends to change with the evidence. But we're doing okay, thanks to the support of many people, many programs, and we're hoping that although this seems like a miracle, we're a marathon, we're hoping we're seeing the finish line soon.
Thanks, Tracy. So again, from your perspective, what has been the biggest challenge for your teams overall?
So from my perspective, it's the lack of visitors and families, particularly for COVID patients. We know it's the right thing to do, and often their families are infected. But the harder part for my teams has been being present, available, spending time, because these patients can go 5, 7, 14 days without seeing anyone but their clinician. It's hard for those patients, and it's hard for my staff. They're in full PPE. They're very, very busy in their units. And often at times, unfortunately, it has been at end of life. We have technology, but we firmly believe that the human touch is something greater. And so we've done our best to be with our patients at end of life or on a day-to-day interactions, but it's hard. And it's hard when we have technology at end of life to watch people pass away.
That's very profound, Tracy. And I really appreciate you sharing it. And of course, it is the biggest challenge, and obviously the whole team has really risen to ensure we can help families and obviously our patients get through it. But thank you for sharing that. And thank you for being so dedicated, and you're a very respected leader. And RVH would not want to go through this pandemic without your leadership. So we're very fortunate to have you on Team RVH. Thank you. All our leaders, our staff, and physicians continue to work tirelessly under very difficult situations. You've sacrificed and put yourself at risk for our patients. We recognize the incredible hard work and dedication you've demonstrated throughout the pandemic, and we're committed to doing everything possible to keep you and our patients safe. To further protect and provide assurance that you are working in a safe environment, last week we distributed 15 rapid antigen tests to all staff and physicians working on site at any RVH location. We already strictly follow infection protocols, but we hope this investment will give you additional layer of confidence, knowing you and your colleagues have all tested negative before coming to work. Just yesterday, we received this email of appreciation from one of our auxiliary staff regarding the rapid antigen tests. I'd like to share it with you. I want to pass along a sincere thank you for the rapid antigen tests I received. I'm truly grateful for this generous offer that helps keep me and others safe at work and home. I am touched that my family will have access to the test should any symptoms develop. It is comforting to know that results are only minutes away. This is such a kind-hearted gesture, and it's gratefully accepted. Thank you, Robin. And Robin, thanks for taking the time to write as well. So Kathy, perhaps you can start by refreshing our memories. Why ask members of Team RVH to self-test twice a week?
That's a really good question, Janice, and so important. And I think Robin actually got it right in that lovely note that she sent forward. And it's all about safety. In fact, it's really safety, safety, safety. And these rapid antigen tests are serving for us right now as our early warning surveillance system, so that for people who are positive with either extremely mild symptoms or no symptoms at all, this is our way of catching those positive cases to keep our staff safe, our patients safe, and to maintain safe staffing levels.
Thanks, Kathy. And, again, back to Robin's comment that, should we test a family member if they are symptomatic?
Yes, the answer is yes. And if you received 3 packages of rapid antigen tests, that's 15 tests in total, 1 package of those really was intended to be used for household members who may be symptomatic. And that's the distinction. It's not, your aunt who lives in Waterloo. This is about people who live with you in your own home. If they become symptomatic, by all means, do use one of those rapid antigen tests. But if you didn't receive rapid antigen tests because perhaps your primary workplace is your home right now, you can have your family member go for a PCR. If you live in the Barrie area, you can come to our Sperling Clinic. And that household member just has to identify themselves as a household member of someone who is part of Team RVH. So that's very straightforward. And even if someone does develop symptoms and has had a positive RAT or a negative RAT, whatever your results are, a PCR is still warranted and available now for family members. That's a change from the last time I joined you at a town hall.
Thanks very much, Kathy. That's really important information. And obviously, if the people use up the kits, Team RVH uses up the kits, there are more kits. We did make a significant purchase to make sure we could keep people safe.
Yes.
So Kathy, there have also been some changes to how long an RVH healthcare worker needs to isolate if they test positive or if they have a high risk exposure. So when can they now come back to work, and why did we make this change?
When we made the change, I want to start there because this, again, it's safety is our promise. And so we've made this change for a couple of reasons. One is we want to have staff back as quickly as possible so that they can be providing excellent patient care. But we want that to be done safely. So there's a couple of things that are important. And part of that actually speaks to, how often we're using the tests and when we're using those rapid antigen tests at home, because sometimes that helps you to determine whether or not you should be coming in. So that's a good thing for you to consider. But when you are positive, and that may have been a positive result on a rapid antigen test, it may have been a positive test result from a PCR, it's important that you stay home. So if you are positive, the gold standard is that you will stay home for 10 days. And that is really applying right now to people who can do their work from home. For most of our staff who can't do their work from home, you will be able to return on day 7, but only if the following conditions are in place. So the first one is that your symptoms are resolving for 24 hours. Now, if your symptoms include vomiting or diarrhea or nausea, your symptoms need to be resolving for 48 hours. You also need to have 2 negative rapid antigen tests, and those need to be done at least 12 hours apart on day 5 and day 6 after you have initially either tested positive or begun to show symptoms. And that's a little bit tricky because we count your first day of either symptoms or a positive test as day 0. So counting forward to day 5 and day 6 from that. And then when you do return from day 7 on, you will come back under work restrictions. You'll be wearing an N95 mask, you'll be breaking in the separate break areas, and that's just to maintain that extra little level of safety. Now, if you are exposed to someone in your household who is tested positive, either by a rapid antigen test or a PCR, the rules are just a little bit different. Gold standard still, if you can be off for 10 days, great. If you can work from home for 10 days, that is still great. However, if you are a critical worker and you need to return to work as early as day 7, there are still those qualifiers. They're just a little bit different than the qualifiers for people who have tested positive. So if you've been exposed to a household member and you want to be returning back on day 7, or your leader wants you to return, the following conditions must apply. Number 1, you must continue to be asymptomatic, and that's really, really important. You then also need 2 negative PCRs, and I know no one loves the experience of getting a PCR. It's uncomfortable, but this is important for patient safety. The first of those 2 PCRs should be done as soon as possible after you start to realize you've been exposed to someone at home, and then again on day 5. And you also need to have 2 negative rapid antigen tests. Those need to be done again 24 hours apart on day 6 and day 7. Now, I'm going to just guess that not everyone listening today is going to have remembered all of that or even been able to take notes. So it's important to go and look at the quick reference guide. The link is in every J&J. It was in the most recent one. It will be in the one again this Thursday, because it is a dynamic situation. And still, Janice, as you will know yourself, we've had a few different variations of these rules over the last month, and it's changing regularly. So go there as your single source of truth. But those are the requirements as they are today.
Thanks very much, Kathy. It is a lot of information. It was really well articulated, but just knowing people can get over to that reference guide and the link will always be there is just really important. So thank you for that. And thanks for all your hard work. And as has been highlighted, this health human resources crisis, this wave has been so demanding on you, Lee, and the whole team. But your guidance and your oversight are so appreciated. And I also want to recognize that you are also a member of the Caring for You committee. So thanks for taking the time. So I know Team RVH is really struggling, and rightly so. You're mentally and physically exhausted and dealing with grief and loss, both in the workplace but at home as well. We can't change the demands on our hospital, nor the lack of human connection or feelings of isolation, but the Caring for You committee is brainstorming ideas on how to make a little difference in your daily lives, help you focus on the positive around you if possible. So we've refreshed the Caring for You rooms and stocked them with coffee and snacks. Also, the lavender cart is making rounds to units, and I hope you'll be able to take advantage of the stress relieving items on the cart. If you'd like to have the cart visit your unit, you just have to contact Gina D'Antonio to make that happen. And obviously, we want you to stay tuned for more news from the Caring for You committee, because there are more just small things that we're trying to put together to put a little bit of lightness in everyone's really difficult days. And in the meantime, of course, know that your leaders and your colleagues, we have your back. So Shar, welcome. And I always appreciate your honesty and your perspective always, but also as a member of the Caring for You committee. So Shar, I want you to give it to me straight. How is your team doing? How are your colleagues supporting each other during this time?
Hi, Janice. Thank you for inviting me. As you know, the nurses of RVH are extremely hardworking and caring people, and I am very, very proud of them. But truthfully, they are tired. They're physically and emotionally tired. I think part of that is the reconciling of our inside and our outside voices. We care about our patients and we know the right things to say, and in our hearts, the right things to do, and we're doing it. But then there's the inside voice that's angry and frustrated. Part of those people have made bad choices, and you feel like screaming at them. Your bad choice has resulted in my fear for my health, for my family's health, for my co-workers' health, for our other patients' health. But on top of that, it has also restricted the ability for us to provide the best possible care. Instead, it's giving the best care we can under the circumstances, which is really not the same. I've seen it, I've heard it, and I've lived it. nurses leaving the building, sitting in their cars, crying for 10, 15 minutes before they feel safe to be able to go home, not just safe in the driving, but safe in presenting to their family in an appropriate manner. They don't want to dump on their families, but that's how they're feeling. I also get that it's really hard for us not to help other hospitals, but when you're working in a department where we've got up to 80% filled with admitted patients, but yet the door is always open, there's no close sign to hang. So they just keep coming in. It makes it really, really tough. However, I don't want to just fill this with negative sentiments. I want to tell you that when we had the people from, or the staff from the OR and PACU come and help us, how uplifting that was. I saw true smiles in my peers' eyes, true smiles that actually brought tears to mine because I was so pleased for them. Then when I found out many of those actually put their hand up and volunteered to come help you, that was even more profoundly understanding. But what that really said to our team was that we were important enough and that we were cared for enough, that it was recognized that we needed help, that we were drowning and someone needed to send us that lifesaver. And it happened. And for that, I am truly grateful. I just want to truly thank all of the staff at RVH that have continued to help, the ones that have continued to show up and put themselves on the plate despite these really awful hardships. And for that, again, RVH is the best place. Thank you.
Well said, Shar, and I know that all of your colleagues appreciate first the frankness, of course, but secondly, the inspiration to just continue to work together. So we have a bit of a note towards the end of that exchange actually with the merge. So looking forward to sharing that with everyone. The emergency department and respiratory unit have really been ground zero throughout this pandemic. And Veronica McGlymont has worked as a registered nurse on the respiratory unit for almost 3 years now. So really much of your time at RVH, Veronica, has been during the pandemic. I know the RESP unit is very busy. We almost didn't think we were going to get you today, so I'm really glad you took some time to be with us while you're also caring for your patients. So Veronica, from a frontline staff registered nurse perspective, what's this wave been like for your team? How are you all doing? And what gives you and your coworkers the energy to keep going?
Hi, and thank you for taking the time to recognize the respiratory unit. Honestly, this wave has just been relentless for us. Everybody here is exhausted. We're overwhelmed. It has been very challenging for us. We take care of 2 units. It's not just respiratory. We also manage 3 South B, so that includes 48 patients in total. So we have 1 resource nurse, 1 manager, and an interprofessional team between the two units. So oftentimes, we do feel overburdened, but we do show up every day because we have such a good supportive team here. And I think that's part of the reason, why we're still here. I feel everybody is struggling. We really have been in this the long haul. We're emotionally, physically, spiritually undone. And to be completely honest, like most days, I really do not have the energy to come to work. But oftentimes when I do come to work, I see my coworkers, they uplift my spirits, they make me happy, they give me that energy that I need to continue going forward. As well as the patients too, we've worked with a lot of patients and you see them, sometimes they'll be here for a couple weeks, a couple days, whatever the process is, however long. It's always good to connect with family and to hear from them, that they're happy that they're going to be coming home. So that's a really positive result of what we do here. And I think my team, like I'm very proud of them for coming in and for having the energy to be here. It's been so long that we've been doing this, and we're going to keep going until the very end because we're here together. So let's just keep going.
Thank you, Veronica. I know you're proud of your team, but I'm sure your team is very proud of you right now for just sharing again so frankly with us. I can't imagine a different response to the question, just given how long this pandemic has been for sure. And it's amazing that the team still pulling together, that whole collaboration, work together and care, and that's what really gets you through the shift, I'm sure. So that is truly Team RVH spirit, but it's not easy and it's getting more difficult. And I just really appreciate you taking time to share that with us. And of course, in addition to RESP 1 and RESP 2, there are those hard hit units, which include the emergency department and getting the much needed support of the redeployment. Now, Shar, you've already talked a little bit about how much that meant to you and to the staff in the ED, what difference it made to have the extra boots on the ground. But is there anything else you'd like to add to that experience?
That extra staff allowed us to do the right things by our patients. Sometimes it gets forgotten that a patient gets seen, they get discharged, but now we're waiting for an ambulance. They're not an admitted patient. They're not a patient of the emerge, but they still need care. Knowing that there were others around so we could meet those needs as well and ensure that even just having that 2 minutes, 5 minutes to actually just listen to a patient's life experience is so good for them, but also for us. And without the help, we just can't do it. We have to be so focused on the task and the needs that the personal side gets put to the side, and that doesn't do any of us any good. So I'm so thankful to have help so we can get back to treating people like people.
Thanks, Shar. Now, I usually close the session with a letter from one of our patients, but just on today's theme, I thought I would just really read a letter of support and encouragement by reading the comments and sharing a photo. So they're from an OR nurse redeployed to the emergency department and some new colleagues she's working alongside. Wendy Adams, registered nurse, says, "Everyone that I have worked with has made me feel a part of the team. With an overwhelming thank you for coming, I'm glad I was able to find a way to help." In the photo, you can see Wendy front and center, surrounded by her new ED colleagues. Tricia Wines, logistics attendant, Brittany Gillard, a registered nurse and our clinical nurse educator, and Jen Miller, RN as well. And Brittany says, "It has been amazing. I think it is really great that a group of nurses can come together, all with the common goal of taking care of patients, despite what unit or department they come from." And Tricia adds, "I can tell you that I saw a weight lifted from the nurses in this department when the redeployed team arrived." It's so powerful. I mean, you can feel that actually, I think, in terms of the particular last comment from Tricia, weight lifted from the nurses in this department. So thank you, Wendy, and of course to all the members of Team RVH who have been redeployed. Know that you're making a difference. I know it can be unsettling to be suddenly doing a new task in a different department with an unfamiliar team, but know your colleagues truly appreciate your help and you are making a big difference in the lives of our patients and our staff. So this next month will continue to be challenging, but by sticking together, supporting one another, and equally important, being kind to each other, we will come through the other side of this pandemic stronger and as a more cohesive team. So until next time, Team RVH, stay safe and stay strong. Take care.